Hey, good evening, everyone. I hope everyone is doing well. This is Rod Carter. I'm a Region 3 Director with the National Association of Black Journalists, and we have some great panelists here. Sia New Yorker, who's the Region 2 Director with NABJ. She works at WIOIO in Cleveland as a reporter and multimedia journalist and anchor. And also the great Al Tompkins, my friend there from the Poynter Institute, who is on the front line of covering talking about issues related to journalists and helping us out in so many ways. And thank you all so much for being a part of this great seminar. We certainly hope that you get a lot out of this, and I'm expecting some great things. We have a lot of ground to cover, so we'll get as much as we can in there. And thank all of you who sent in questions. Those questions are going to be fantastic. Before we get started, though, we have a quick message that we want to play. It is from our president, Dorothy Tucker, just to welcome you all here.
Greetings, my friends. As president of the National Association of Black Journalists, I welcome you to the NABJ webinar on coronavirus. We are all in this together, facing the same challenges, trying to do our jobs and stay healthy. Please remember the work you're doing is critical to the safety of our country. Keep reporting the truth. We will get through this together. Thank you for joining. Enjoy the webinar.
And Dorothy, thank you very much. So we want to get started, and I think we're going to get started at the place where we've gotten a lot of questions already, and that is sort of the issue of self-care. And when we're out covering these stories, how do we protect ourselves physically, our health, and also emotionally? So I'm going to start, if you guys don't mind, we're going to start with Sia. Sia has been on the front line there in Cleveland, and I think you've covered the clinic a lot there.
Yeah.
And sort of tell us a little bit about some of the things that you do to kind of keep yourself safe in terms of healthy and then sane as well.
Yeah. So thank you. So I've been covering the coronavirus pandemic here in Cleveland. Cleveland Clinic is at the forefront of the testing. On Saturday, I was one of the first reporters there when they opened their drive-through testing clinic. And so I was there to watch as the first patients rolled in to do this drive-through testing, and it was very sobering because I had no idea there were going to be that many people. In fact, we got numbers that I ended up reporting on Monday that 770 people were tested those first 2 days, that Saturday and that Sunday. And there were so many more people that were turned away. And so as we're covering this pandemic, we as journalists have to keep ourselves safe as well, doing the social distancing, making sure we're using hand sanitizer and washing our hands. And so I just want to show you what my photographer ended up doing yesterday. He ended up rigging a boom mic, an old microphone, and putting it on like a standstill. And that's how we were actually able to interview people for St. Patrick's Day for some of the celebrations. And so it's one of those old mic stands that are in the studio or in a closet somewhere. Nobody's used them, for years. And so we pulled it out, and we actually ended up being able to keep a safe distance. Can you guys see the photos?
They keep flipping pretty fast.
Okay. So,
yeah.
So that's one way that we're able to, to keep our distance and keep ourselves healthy, because we still want to get out there and talk to people about what's going on and about, possible cures and testing and things they need to do to slow down the spread of it. And so that's just one way, keeping our distance.
Sia, have you been nervous out there while you're doing this? I mean, I'm out there covering these things too, and I found myself doing a lot more Skype interviews or FaceTime or telephone interviews or recording just audio.
Yeah, definitely. Very nerve-wracking, actually, because you don't know, and especially being at the Cleveland Clinic at the drive-through, where you see people with masks and they're covering up their heads they're coughing, they're sneezing. They have doctor's orders that they could potentially test positive for this coronavirus. You don't want to get too close, you know, and then too, you want to protect their privacy as well. You know, we're in a public space, but you still, you know, want to maintain some distance because they could test positive. They very well, so you have to be careful.
Al, I want to bring you in because late this afternoon, my news director also kind of gave us a directive to make sure that when we're out there, we're not getting too close to people, kind of doing what Sia is doing, saying put it on a mic stand or something, walk away, then have the person walk up and have them do the interview, but do it from a distance. What are your thoughts and suggestions for journalists out there, and especially in a multimedia kind of world where a lot of MMJs are out there, to be able to do this and keep themselves safe?
Well, there are a couple of issues. One is you don't want to add to the problem. So one of the issues that we have is how do you seek truth and tell it and not become part of the problem that you know that you're also trying to cover. I think this is where we're going to have to start getting really thoughtful and creative. You know, I was noticing that what Sia was showing us was basically a handheld microphone on a boom, but remember, a shotgun microphone also can work. And you can also hand somebody a wireless microphone that they can pin on themselves, which would work, and then just sort of back off from them. So you could, you know, put down the wireless microphone, they can pick it up, put it up on themselves. That would work. A long time ago, I remember interviewing someone who was immune deficient, and we interviewed them from outside their house and actually had them pick up their cell phone, and we interviewed them through their front window, them on their cell phone, and it worked just, you know, great. So we're gonna have to get a little bit thoughtful here about how we do these and go lower and lower tech. And look, if the content is good enough, the public is totally going to be fine with it. I mean, we look at Skype interviews and things like that on our computers and stuff all the time, and don't say, "Gosh, why isn't that in 4K?" If the content is important, then we'll endure some of the lesser quality. It's when we have lesser quality and crappy content that people aren't going to put up with it, right? This is also time for you to be thinking about, do I really need to talk to this person, right? So what I would say to you is very often we end up interviewing people and saying, you know, what are you worried about, or how concerned are you, or whatever. It doesn't matter. Those aren't the kinds of questions we ought to be risking anybody's health for. The kinds of things that we need to know right now is, what do I need to be doing? And so be thoughtful about why you're going out to talk to people. Is it really valuable? Is it really important that I go there? It's sort of like covering things in a storm and those kinds of things. I mean, you got to ask yourself, is this worth any risk at all? Not just to myself, but to whoever it is I'm working with. And potentially, I mean, you also have to remember that it's also possible, not likely, but it's also possible that you might be a carrier. So right now we're talking about not wanting to get infected by somebody else, but within another week or so, it's just as possible that you might be the one who's causing problems for the person you're talking with.
That's a perfect segue into the next question that I was going to ask you, Al. We've seen a lot of anchors, present company included, who have now socially distanced themselves on the set. What are your thoughts about that?
Oh, that's fine, as long as it's actually that. I mean, what I've been hearing is that people are coming off the set, going right back to the newsroom and sharing pizza, you know? So, I mean, it's all almost for show. And so, yeah, what we do at the Institute is, you know, we sort of wave at each other and talk to each other on the phone, even when we're sort of not very far away. And when somebody does actually come toward my office, they stay in the doorway, which is away from me by a way. You know, it's common sense stuff, right? But don't miss the opportunity to teach too. So if you are sitting far away from somebody purposefully, don't ever underestimate the value of explaining to the public why you're doing that. I mean, this is important that the public understand. We're taking this seriously enough that we're doing this. We're doing 2 shots instead. We're doing 2 boxes instead of you know, standing next to each other and so on. And just because you said it yesterday doesn't mean I heard it. So remember that still people don't actually why. I mean, for you, your audience watches you every minute that you're on every day through, 5 days a week. But most audiences are not as loyal as the Rod Carter audience, right? So what I would say to you is you have to remind people what you're doing, and you're going to get tired of saying the same old thing over and over, and yet that's what you've got to do.
Have you been fielding a lot of questions from folks about this very topic? Because I think you posted something, was it the 15th, yesterday, a day before yesterday, with you and your wife talking about self-care in terms of how to make sure that you take care of yourself. And for those who don't know, Al's wife, Reverend Sydney, is I don't want to mess up the title.
United Methodist.
United Methodist. And
not a United Methodist pastor, but also a licensed psychotherapist with 45 years of clinical experience. Yeah, Sydney and I have been doing, for a few years, we've been doing traumatic stress workshops in addition to the stuff that I do at Pointer. But when the coronavirus story really came up, we started getting a lot more calls, first from Europe and then, Asia, Europe, and now, of course, here, where journalists were saying, I just can't shake this. I'm thinking about it all the time. I don't sleep. I'm worried. What do I do? And so on. So we, on the Pointer Institute website, maybe somebody can punch it up in our notes here, but on the Pointer Institute website, we ended up posting on Sunday about a 10-minute video to help people to process this. And we've been talking with newsrooms. We had Dallas Morning News was one today. We did an hour with them today, just talking to them about their concerns and so on, because remember, they went through Ebola and they actually had quarantines there. So yeah, we're talking to them. And look, here's the thing. You got to take care of yourselves. You got to, those of you who are working at home, you got to spend some time thinking about what that is and how you're disassociating yourself from your supporting network. People are going to change their eating and drinking habits. People who have addictive personalities are going to risk overeating, over drinking, and so on. So all of these things are going to be really important that you be thinking about. Where are your escapes, and what are you likely to do in the worst case scenario, and how do you recognize that in yourself and start taking steps on that? The other thing, Rod, that we've been talking about, and I'll stop in just a second to let people just ask more questions, but one thing that is important, really important, is that you recognize that what we're going through right now is not normal. It's normal for us at the moment. It's normal for us probably for a while. Sia has been covering this nonstop. It's normal for her right now to go out and see all this. That's her norm, but it's not going to be forever. It's just not. This eventually will subside. We're seeing in China now, for example, that life is getting back pretty close to normal, although they may well have another round as people come back to China. So two things about this. One, this won't last forever. And we will someday return back to your normal life when you do all the normal stuff you do. Two, start reminding yourself of what normal looks like. And that means have photographs or whatever it is that reminds you that normal life happens. I'm looking outside right now and I see a fantastic sunset over the Gulf of Mexico.
Yeah, it
reminds me that the sun is going to be there, that it's beautiful outside. I start seeing leaves coming out on trees when I was in Baltimore last week.
Nice.
You've got to remind yourself that things are going to be okay. We just got to get through this, and it's going to be ugly. It's going to be really ugly.
And I just want to thank everyone again, those of you who just joined us. This is a great panel discussion that we're having here through the National Association of Black Journalists, Al Tompkins with Pointer Institute, and Sia New Yorker, who is a reporter and anchor at WOIO in Cleveland. And one of the questions, Sia, that we just got a second ago was kind of for you. And it's really interesting because it's a question that I never thought about, but it says, Sia, if you're interviewing with an extended microphone or 6 feet away from an interviewee, how do you maintain that distance without projecting condescension or disdain towards the person that you're interviewing? So, I mean, I never even thought about the fact that it's kind of funny when I go out and do interviews, I'll go, hey, I'm not shaking your hand. And I think it's for both of our protection, but I wonder how people are receiving that. Have you seen any negative responses?
No, I've not seen any, because we're supposed to be social distancing. And so that's what we've told our viewers to do. So we have to practice what we preach. So nobody thought it was odd yesterday that I was holding the microphone out like that at all. In fact, they thought it was pretty cute. They thought it was pretty nifty, and they took pictures of it. That's how we got the photos.
That's
One thing
awesome.
you might do, Rod, is remind them that you're doing this for their protection.
Absolutely.
So instead of it being for our protection, like, I don't want your germs, you germy person, it might be, look, I don't want you to have to come close to us. So, you know, this is a way for us to hear you, because it's really important that we hear you.
Right.
We want to make sure and hear what you say, but you don't have to get close to us.
So we have a lot of questions. I'm going to go ahead and get started with those because there are a lot of them. And I'm going to start just with this one because I think it's important. We may have a lot of students who are online. And so one of the questions is from a student, and it just says, from a student perspective, what are some examples of how to cover the virus in an impactful way?
Yeah, I've been thinking a lot about that, and I'm glad for that question. I've heard this, probably it's the #1 question I get from college educators. So here's my thinking about this. This is a time for you to cover stories that only you can cover. And you probably could teach us a lot that will have lasting value. And here are a couple of ways you could do that. One, think about being able to assess whether or not this remote learning experience is really good learning. This would be a time for you to evaluate what works, what doesn't work, to talk to your classmates, to talk to people you know, to ask them what they've experienced and to interview them for your stories. I mean, I think this could be fantastic. And even though you're not able to talk to them one-on-one, you know what, from a visual or point of view, if I were interviewing you, if I were doing a story about remote learning and all my interviews were remote, it would make sense. So visually, it would make sense to me.
Yeah, and I was going to say the same thing. I think this is a prime opportunity because in the state of Florida, every university is affected. So there are so many stories that university students could tell easily. For example, there's no fall commencement ceremonies, or I'm sorry, spring commencement ceremonies.
Right.
Perfect story.
Yeah.
And there's a lot of opportunities out there.
You're exactly right. So do those stories. Here's the other thing. What we know about young people, I was talking to my son who's in grad school in the University of North Florida. I said, how are you communicating with others? He said, well, we are joining Netflix party tonight. And I said, tell me about Netflix party. He says, oh, we could all watch the same Netflix show and talk online about it. And I started looking into that, and I found there are about 8 or 10 of these really wonderful online tools that you can use to have virtual gatherings, even to watch videos and movies and so on. Fantastic story. How do we get past this? What about people who are in loving relationships with each other? How do they do that? You know, how do you, there are at least a gazillion of those kinds of stories. Focus on things that you as young people uniquely have access to. And I'll tell you, I can tell you that Sia and Rod and others will take those stories and would love to have them. They would love those kinds of stories that only you young people would be able to do. And it'd be great for your resume reel.
See, let me ask you this, because one of the questions that came in is there's a lot of confusing and misunderstood information regarding the coronavirus. What is the best source to get a clear explanation of what the virus is? It's interesting. Someone posted on my Facebook page something about, well, it's COVID-19. What were there, 18 more? And I said, the coronavirus has been around for a while. And I went and found a link and I sent it to him. But then as I read that link, I'm like, you'd have to really be a scientist to understand what I just sent this guy. But how do you weed through some of that information when you're out there seeing?
Honestly, I mean, like other kind of information, you just kind of have to break things down for people in layman's terms so that they can understand it. You know, interchangeably, people have been using, you know, coronavirus, COVID-19, corona, going back and forth. And so for me, I feel like the best source would probably be the CDC or your state board of health to find out exactly. I mean, because we, you know, our governor, Mike DeWine, has been very involved. He's been calling 2 p.m. press conferences daily. And so we're getting an update from, you know, the health director, him, and other people. And we just have to just break it down so our viewers can understand it. So like you would do anything else.
Well, it's very nice that he does 2 p.m. news conferences. Our governor does 5 or 5:30. So every day for like the last week, they've been blowing up the evening newscast. It's interesting though, because that leads me to a question that maybe Al and Sia, you jump in here too. You know, we have some producers, I'm sure, who are on the webinar as well. For a producer, taking this tremendous amount of information and then breaking that down into bits and pieces that the general public can fully understand, is a very tough thing. So we find ourselves taking, I think, a lot of news conferences just full. Al, you have any suggestions for producers on how they can kind of segment this information to make sure that the pertinent information is covered?
Well, I would suggest a few things. One, don't get in a hurry right now. This isn't a time to be worrying about your production values and how many over-the-shoulder graphics you can slip in. This is time for clarity, depth, and repetition, honestly. Don't clutter up the screen. I always tell producers, look, one thing you need to do is you've got to get rid of all these adjectives. No more fantastic, unbelievable, gut-wrenching, mother's worst nightmare, tragic, deadly. Get rid of them. Get rid of the adjectives and go for facts. In terms of segmenting, what I would suggest to you to do, and this is what I'm trying to do on my morning newsletter, is I'm trying to think about, okay, what can I promise you today in this newscast or in this email or however it is you're distributing? What can I promise you, and how can you consume those? I can't fire hose this. I've got to say, okay, here's what we're going to do. We're going to tell you what's going on the international level, the federal level, the state level, and then right here in this county or parish. So, and then you sort of keep walking it down. Banners can help at the bottom of the screen. Sometimes you can, like USA Today, you can color code or something like that, the banners. There are all kinds of ways for you to think about segmenting this, but don't intertwine national, international, state, and local. I start getting confused. Where it becomes even more difficult is when you're working in a coverage area that's multi-state. So, for example, years ago, I worked in Paducah, Kentucky. We had 4 states we covered. Okay, so you got 4 different governors, 4 different departments of health. And that becomes really confusing. Louisville, Kentucky is, Indiana, Cincinnati, Ohio. I mean, you have a lot of big metros that cover multiple states, and it makes it even more difficult. So then it becomes important that you label those screens, help people to understand what you're talking about, because people are not hanging on every word.
That is very true. One of the questions that we got is, how can you ensure that our coverage on some stories doesn't contradict the main thing we're telling people not to do? For example, and this is a really good one because I think we've all, and see, I'm sure this fits right in with the clinic example. We're put at a retirement home or clinic, if you will, where there's a huge outbreak, or interviewing people who say they think they have the coronavirus. So we tell people, stay away, socially distance, and then we're there. How do you reconcile that?
We're not doing it. You can't. I mean, you can't. I mean, because people will call you out. That's the thing. On social media, they'll say, hey, you said not to do this. And then here you are doing it. So we've all taken a bit of a step back. Like you said, we've been doing Skype, FaceTime interviews. If we have to go out to a scene, we are far away. You don't want to be hypocritical, because then people won't trust what you're saying. Yeah,
that's very true. Al, thoughts?
Yeah, I think Sia is exactly right about that. One of the things I've talked a lot about is every time you show somebody wearing a mask, particularly the mask business, or doing something, you've got video of people interacting at bars and so on. Every time you use that image, every time you use that video, you've got to tell me this is not in keeping with the recommendations. Particularly critical right now that we not use file tape, nobody's used tape, that we not use file video. I didn't say film, at least. So what I would say is you got to be really thoughtful now about what we're telling people, because the old saying is seeing is believing, right? And so if you're telling me one thing, showing me something else, I'm going to believe what I see. I want to make sure, and NABJ has spoken loudly about this, as has AAJ and others. I also want to be really careful about who I'm showing. Early on, particularly last week, most of the images that we saw of people wearing masks were Asian, because a lot of that video was coming out of China. And let's be really thoughtful here about the images that we're showing. Now's the time for us to realize that every single thing we show and say is in some way teaching, whether it's intentional or not, Sia.
And did you have some video examples that you wanted to show us, Al, of some of that, some of those things?
No, I'm not going to for the express reason of I don't want to do what I just said we shouldn't do, right?
Okay.
Everybody
Duly
knows
noted.
what I'm talking about. I don't need to do it.
Duly noted. Duly noted. There was another question I had here. We hear a lot about the number of cases, and this is fascinating to me. I want to hear this answer from both of you. We hear a lot about the number of cases and the number of deaths, but the media rarely talks about those who survived. Why is that?
Oh, well, because we focus on the people who didn't get home tonight, right? You didn't do stories on everybody who drove home safely and everybody who, so ours is the unusual story. I do think, though, and Sia may speak more directly to this, I do think that we are way underreporting the number of positive cases of people who are younger. A friend of mine in Tennessee sent me the data tonight, and it turns out that the largest cohort so far of positives are not 60 and over. So we've got to start watching how we report this and whether our numbers are consistent with the numbers we've seen globally.
I had an interesting question. Sia, did you want to weigh in? I'm sorry.
You know what, I was just going to say that, I mean, this was just declared a public health, a pandemic. And so we're not there yet. I think maybe in the next, I hope, couple weeks, we might hear those survivor stories. Right now, I think it's interesting. We're hearing from people who believe they had coronavirus months ago. They had upper respiratory infections, they had flu, and no one knew it was coronavirus is what they're saying.
Well, it probably wasn't.
Yeah, but I look forward to telling those survivor stories. I do.
I agree with you. One of the interesting questions that we got to early on, one of the first questions I think that hit my inbox was from someone who covers the transportation industry, specifically the freight industry, primarily by truck. And it says the supply chain is critical to the business of trucking and to consumers. What are some of the threats to the supply chain with this outbreak?
All right, so I saw that question and I started looking into it. There are a few things. One, the supply chain, let's start with food just as an example. Supply chain for food as we sit today is not in trouble. There are shortages, obviously, of a few things, but the capacity to supply those things is pretty good. So fruit, vegetables, meat, the Department of Agriculture and even the trucking and rail companies are all saying, look, we have plenty of product. There is an interruption because people went nuts and bought up a bunch of stuff they don't need, but they're stuck with that now. They'll be consuming that. That means they'll be slowing down their consumption. Remember also, we have restaurants that are not using, so we've got a much lower restaurant usage. Just for example, the poultry industry. Purdue Chicken said that about 15% of their capacity goes to restaurants. I'm sorry, about 30% of their capacity goes to restaurants, 15% international. They said, we're not shipping international because of the problems doing that right now. So everything that was international is coming back to the home market. Restaurants aren't using as much. That's coming back to the home market. There's plenty of chicken. Now, the problem is going to come if we end up with enough sick people that we don't have trucks running. That would be a real problem. And that's a problem in a lot of places. It's a problem, for example, in group homes for disabled people. It's a problem for jails if we don't have people showing up to be guards. I mean, the people showing up for work issue may well be the real problem that we have.
Right.
But it's not our capacity for food. We've got that. It's like toilet paper. We've got plenty of it. We just got to get it to you. But there's plenty of it. There's no shortage of toilet paper. There's no shortage of Lysol. There's no shortage of any of that.
It's interesting.
It's transportation that's the issue. Let me also say that Amazon, which has become one of the big distributors of this, Amazon says they have lots of product. The problem is that people are just consuming huge, unseemly amounts of it.
It's interesting that you say toilet paper. That seems to be the story that, just caught fire and people.
Okay, there's a reason for this.
Okay.
So here's the reason for it. And I actually talked to a crisis communications expert at the CDC about this. What happens is that when there is an invisible foe, like a virus, we don't know what to do. I mean, if it's somebody who's attacking us, at least you know who it is. If it's a hurricane, we know where it is. We know what to do about that. But this is an invisible foe, and so as humans, we have a fight or flight reflex when we're confronted with something. So our way of fighting the invisible foe is to do something tangible. So the tangible is, okay, what do? I buy something. Well, what else could you do? You could wash hands. Well, I'm doing that anyway. That's stupid. That's silly. That's not enough. I need to arm myself with something. Okay, toilet paper. So what do? We buy toilet paper. But the second thing is, and I'm doing this, I'll give you a little headline. I'm doing a thing in tomorrow's email that goes at 7 a.m. Gun sales and ammo sales are through the roof. Ammo.com says they've had a 60% increase in ammo sales since February.
Let me interrupt you because that's interesting.
To do. That's the issue.
We did the gun story. We've done the toilet paper story so many times. It's unbelievable. Sia, one of the questions that we got is, how do you come up with different story ideas? How do you come up with different story ideas? One of the things for me is, today, my story was about how nonprofits are affected by this because so many of them have events that take place that they've had to cancel or postpone or reschedule or whatever the case may be. And it literally was born just completely out of the fact that I MC, it seems like everything under the sun, which I love doing. But so many of the things that I was emceeing over the next couple of weeks have been canceled. So that led me to think about what those folks are having to deal with. How do you come up with story ideas and how do you make them different so that everything doesn't look the same?
I listen oftentimes. They'll send in messages, they'll DM you on Facebook or Twitter or Instagram, and they ask you questions like, hey, what am I supposed to do about this? Or what's gonna happen? A lot of these children are not in school because schools are closed and they're getting breakfast, they're getting lunch, so what's gonna happen? Which is what happened, which led to my story that I reported today about the Cleveland Food Bank and how that place is run by volunteers. And since we're supposed to be social distancing, a lot of the volunteers have called out. Meanwhile, the hotline number for the hungry kids and the struggling families, those calls have skyrocketed. And so they need people to come in and still volunteer. They need to get out and feed these hungry kids. So it comes from sometimes simple questions. You just sit there and you gotta, you think about it and it makes sense. It's like, there's no school, there's no breakfast, there's no lunch. Somebody needs to feed these. Who's gonna feed them? The nonprofits, the food bank. How are they gonna do that? And you can get a few stories out of it.
Well, I also want to remind you, 7 o'clock every morning, I got story ideas coming in your email. Yeah. It's just one of those, and I'm trying to point you toward data that anybody could use anywhere. So that's one thing you can do. I also want to promote an idea. Again, this is in tomorrow's email, but I want to promote an idea that everybody everywhere could do. And that is what I'm calling Corona kindness. I think every news organization ought to ask viewers, listeners, readers to send them daily examples of somebody doing some very kind, loving, beautiful thing.
I love it.
Let me stop you because and I think it's a great idea, but the reality is when you pitch a story like that to your newsrooms, they're not going to say, you know what, that's great. They're going to say, okay, but we need to do something on this. So how do you get over that hump?
Well, that may be true. It may be that you have to go do another whatever it is story today because that's what needs to get done. I get that. And then you come back tomorrow and the next day and the next day. But here's the thing. We can't just keep beating people over the head with you ought to be scared of this and ought to be scared of that. We're going to have to give people hope. We know that in any crisis, we have to give people hope.
Yes.
And the sooner the better, and nonstop would help. Partly because when we see people do things that are kind and hopeful, it speaks to all of us. And we can say, oh, look, if Sia can do that, I could do that.
Yes.
And it's sort of one of those campaigns that people latch on to, right?
Go ahead. I'm sorry.
No, I'm saying you need to this is where you rally the troops. You go into the newsroom and you tell the producers, hey, I've got this good idea for this segment. I think it would be really cool. And you make it a little, not a franchise per se, but kind of like a On the Road with Steve Hartman. Just a little something in the newscast.
Oh,
Well,
I don't even think I'm not even going for the end. Look, why bury this? This is as much a part of what's going on in your community as every piece of bad news. So no, I'm not saying bury this at all. There is every piece of research I've ever seen says that people want encouragement. They want to know what's going on. You ask, Rod, you're out all the time. What do people say? It's always bad news, right?
I agree. And here's the flip side for me, though. I pitch those stories ad nauseum, and I don't always get to do them. So once in a blue moon, every 2-3 weeks, I'll get to do that. So I agree with you. The struggle is real in making sure those stories get told. Just a couple things. Thanks to Brian Waters, who posted on the webinar chat that he works for Johns Hopkins, and they have in media relations, they have a guide, and he's put a link to that. Also, just for everybody to know, I put a link. I put all of our contacts on the side there. So it's for Sia, for me, for Al. And if you're going to tweet, please use hashtag NABJ covering Corona. And we also put a bunch of links and resources. Yes, and that's a segue to my next Sia question. We put a bunch of links for people also to get good information. And Al, your information is there. And I talked with some folks here with the Crisis Center about ways to cope and deal with anxiety that surrounds us. So we put a couple of links in there. And for specific questions about the CDC, we put a link in there. But backing up, Sia, are there any you're a fantastic multimedia journalist, and I've watched your work for years, and I know that you're kind of out there and do a great job with multimedia, do a great job with social media. Are there any apps that you have in your toolkit for people to be able to use to tell stories in a different way that will help them?
I honestly, really, I use the basics that everyone else is using. The Instagram, I mine social media to get story ideas. I make sure I reply to viewers when they DM me. The same that everybody else is using. I mean, I do like to, when you're on a story like this and you're doing back-to-back live shots, I utilize the News On app because I like to see what I did before and what I can do better, what I can change, for my next hit. So, but I'm using everything everyone else is using, to be honest with you.
I'll tell you, I have two that I use a lot, and one is called Quick. It's really it's an app for, I think, GoPro. And I use that sort of as a promotional tool. So it puts together really quick little stories that you can use, short videos, or pictures, and it'll allow you to put words in that sort of thing, and music. And I use that a lot for promotional purposes. And another one that I use is called Magisto, Magisto, and it's kind of the same way. It does a lot of promotional stuff. So whatever I do on air, if I want to heavily promote it on social, I use those two apps. Quick is free. Magisto is free to an extent. If you want to download it, I think it's either 99 cents per download or it's $6.99, I think, per month to use that one. But again, it's QUIK and Magisto, Magisto.
Look at me, App Store.
I know, right? I love those. I'm
reaching for something here, so sorry.
Okay, no worries. So one of the things, and you can answer this for this person, Sia, what tips do you have on how reporters can report the latest on coronavirus in an accurate and serious way without sounding alarmist? That is probably the biggest criticism we get. A lot of people think that we're fueling the fire, if you will, and it's all our fault. I've heard that more times than not.
A lot of it is your age. If I'm anxious on camera, looking like this all the time, looking like a deer in headlights, that's going to make the viewer nervous. So, this is the time for us to stand up, and we have to be authoritative. We have to command and be in charge of the story. Whether I don't know everything about Corona, I don't at all, but you would never see me, cowering like, oh man, biting my fingernails. I mean, it's like we would do anything else.
Mhm.
You know, there have been other things that we've covered that are just as difficult, just as challenging, and confusing. But you've got to just be about it.
Heather Chen, thank you very much. She said in our chat side that you could, newsrooms can utilize columnists for positive stories. And so there's a link there for that too. So that's a great idea. Thank you very much. Al, your thoughts on how we can present all of this information without it sounding as if everyone's hair is on fire?
Well, part of it is to try to find what's working rather than just focusing on what's broken. So I was thinking about that as people were running to grocery stores and we were doing, they're out of this and they're out of that. The real story is, how can you help me find this or that? So it seemed to me that we were focusing on the easy stuff. People are rushing to get this. There's no toilet paper, there's no bread. Can you help me find the things that I'm looking for? It's a different way of looking at it, right?
Mm-hmm.
One focuses on the rush to do whatever. The other is helping me to solve problems. What I'm trying to think about every day as I'm writing is I'm trying to think about, what do people need today? Not just what are they curious about? What can I give them uniquely that nobody else can? So obviously can take us to the Cleveland Clinic, which is different. She's going to get a different story than anybody else anywhere because of her access to have that. It's important for us to ask ourselves, what uniquely can I give you? And what do you need from me today to get through this? How can I help you get through this? How can I help you? What answers, what questions do you have? And it seems to me that you could actually ask people every day, are you telling us what you need from us today? One of the things that Pointer's been doing a lot of, we have 60 journalists working internationally. We have 40 high school journalists working around the country, and they're doing fact checking, and that in addition to PolitiFact. So that's over 100 people around the world working on fact checking, and people are eating this stuff up like you can't believe.
Mm-hmm.
They want to know these answers. And one of the things that you as journalists can be doing is to be looking particularly for the International Fact Checking Network, which is housed here at Pointer. Look at what fact checkers around the world have been looking at, because remember, most of the world population now has been in front of us. India, China, and so on. They've all been in front of us on this. They've already experienced the worst, or are experiencing the worst that we haven't yet experienced. They're a week or two ahead of us on that schedule. So what rumors made it there that did not make it here yet? And how can we knock those down before they get here?
One question just came in to ask about Google Tools. How effective is Google Tools for you? And I don't know, see if you use that as well.
Okay, so there are lots of tools I think are really interesting. So I'll try to answer the question different ways, and you can keep asking. Remember that Google Sheets is particularly useful because we can use it to graph and chart things. You can put in spreadsheets, just go up to create a chart, and you can see what the data is telling you. That's important. There are a couple of other things that are really important here. I was just looking, before we came on, I was looking at Google Trends. And one reason I look at Google Trends is to find out what people are searching for. What I want to know is, what do people want to know? And Google Trends will tell you that, not just by state or country, but it'll also tell you by major municipalities. So I could go to Cleveland, I could go to Tampa and see what search words people are putting in. Here in Tampa, they're putting in Tom Brady more than anything else. But other than that, most normal places are, looking for other things. So that's really, really useful. Google Data is also new. Google Data is going to allow you to pull up data sets. And Google Fact Check is brand new. It's only a couple of weeks old. Google Fact Check is allowing you to search known fact-checking sites like PolitiFact, just as an example, to see whether or not any reputable fact-checking organization has looked at that story or that allegation. So there are a lot of tools that are really useful to be able to short-circuit your searches.
Thank you, Kim Smith. We got just a note on the side from Kim Smith, a journalism educator at North Carolina A&T in Greensboro. And her research is on health literacy. So she's put a link in of vetted health websites that reporters might find useful. Also, there was a message from someone who said that they are in PR And are there any good tips for being pitched by PR people about COVID-19? I will tell you, it says, I saw one reporter tweet that he's tired of receiving corona pitches. So what would get your attention? For me, I will tell you that we get a lot of those things in our inbox. And if I don't really know you, if they're just blind emails, that kind of doesn't do anything for me. So I would think you have to make some sort of connection with somebody in the newsroom. I get a lot of those. I think we all get a lot of those.
Well,
So,
I would say that in order to get a good pitch, get me a character who's going to be able to say something interesting. I need a character. I don't just need a machine.
A talking head.
So, for example, here's what a PR pitch from a hospital could be today. Yesterday, the Vice President of the United States wanted construction companies to donate masks to hospitals. Did anybody do that? You know, did you get a call? As soon as you get a call from a construction company coming with 5 box loads of masks, call me, because that's something I can take a picture of. It's something I can see.
Right.
It's somebody who's doing something. It's, you know, something that's actionable, something that's doable, something that I can take a picture of, somebody that I can talk to. All of that is valuable. Anything that's just a study or something that's self-promoting, no thanks.
Exactly. Sia, you were going to say?
I just think that some of these PR folks need to use some common sense. You know, I can't tell you, my inbox is full of pitches. You know, what are your plans for Mother's Day? And, you know, and I'm just like, you gotta be kidding me. Like, nobody's thinking about Mother's Day right now. Like, there may not be a Mother's Day. Mother's Day is canceled right now.
Right.
That pitch does me no good. It's instant delete, unfortunately. But I think you need to be purposeful and intentional.
And I apologize. Kim Smith at North Carolina A&T is a he. My apologies. Thank you for correcting me. I'm so sorry about that. One of the comments or questions that we got was from a freelance journalist, and this is interesting to me. A freelance journalist wants to know, how do they cover, you know, the story? How do they find places to do stories and cover these stories, and contribute to the urgent story and impact folks and be a part of society?
Well, first of all, let's just give some heartfelt love to a freelancer right now. It is a tough place to be. So first, thank you for your work. Second, like always as a freelancer, you got to find your unique place in this. My suspicion is, first of all, stay healthy. Okay. It's going to be critical that you be available in another week or two. Because as we start losing people who self-quarantine because they think they've been exposed or they actually have, you're going to become more and more and more valuable. Get yourself on everybody's quick call list, be available, make sure you've got all the skills you're going to need to do stuff, be able to go and work in social media, educate yourself now on their CMS, whoever it is you think you're going to work for. If you can spend some time right now being CMS literate on whatever it is they're doing, that would make you more valuable than coming in and not being able to do anything for 2-3 days, because nobody's going to be able to acclimate you. If you're freelance shooting, if you're out telling stories, get me stories that I don't know about. Take me places I've never been that I want to go. You've got to be unique. Freelancers know this. They're really good at it. You got to give me what I can't get.
But there is a place out there for freelancers. They just got to get
No
on the
doubt.
radar.
It may be they're going to be a lot more valuable next week and the week after, but they've got to be healthy.
So this is, and it's interesting. This is an interesting question that we got. Is there any job security for someone in our business if they refuse to do a story or be in an environment that puts their lives in jeopardy? Sia, let me start with you, because I want to ask, has there ever been a time for you during this or any other coverage that you've been a part of that you say, absolutely not, I'm not doing that?
Oh, I mean, we've all been there. But you know, let me just say I'm very vocal about my safety. I've told previous and current news directors, I don't want to be a VOSAT. I don't want somebody, you know, doing some story on me, you know, because I put myself in an unsafe situation and I'm no longer here. And there's the story, oh, she was a great colleague. And so I think you have to become, you know, you have to be comfortable. If you're not like 100 about it, you have to speak up about it. And so I think all over the country, I'm seeing many reporters and anchors working from home. You know, some of them are pregnant and or have young children and they don't want to expose their whole family. And so I'm seeing a lot of employers being very understanding about that. And, I feel like, I really feel, at least for me, my management here, that if I did not feel comfortable, I could go and tell them, you know what, I can't do this. And they would find something else for me to do. And I know
Don't
it's not
wait for somebody to find you something to do.
Yeah.
That's the main issue that I find, is that Sia is not going to get told what to do because Sia's got stories. But
Right.
where you come in and you've got nothing, that's when you're going to get assigned. And it should be your goal never to be assigned to anything. That you come in with a Rolodex full of stories. A Rolodex is, never mind, nobody's got one. You've got to have stories.
Yeah, that's the good thing about being a multimedia journalist, though. When you wear the hats of doing 4 and 5 jobs, I can do digital, I can be a photographer, I can be a reporter, I could be an anchor. You can do things.
I think also that we're in such unprecedented times. I think there's probably a lot more leeway in that right now, in the sense that if you go, I really don't feel comfortable standing inside this, this particular place the whole time, versus in a story before, it's like, oh, I don't want to do that. That may be a little bit different.
Rod, but here's what you would do. I mean, what you would do is say, I don't want to do that, but here's what we could do.
Right.
Or what producers don't want to hear, and what Sia will tell you, is producers don't want to hear you're wrong. What they want to hear is, you're right. What if we did it this way, right? So what you've got to do is make sure your bosses understand you're not trying to get out of work. You're trying to do the story that they envision, but it may take a little different form. And I always say, when my bosses come to me and want me to do something, my answer isn't no. My answer is, what if, would you be open to negotiation on how we do that? What if I found another way to get to that? Bosses don't want to hear they're wrong. Not at all. And that's not my job. My job is to get it done. But also
we got a question. Got a question from a producer, and it says, what if you're a producer and you're told to do something more often than not? And then in parentheses, it says, unless it's weekends. And full disclosure, it's my producer asking this question. And so we have this discussion a lot. But what if you are told you will lead with this and you will lead with that and you won't put this in? How do you combat that?
Well, they are paying you a check and you are paid to do a job. Now, if it's unethical, illegal, immoral, then you've got a different decision to make. But there are times when my bosses tell me, you know what, this is what we're doing. And my job is to say, okay, I'll do that the best I can. If I may or may not agree with it, but I'm taking a paycheck and I work for you, and it's my job to support that decision the best way I can. If it's not unethical, illegal, or immoral, then do it, get it done. And then remember, you've got more hours to do more stuff. So get that done.
This is a great question, and either one of you can field it. And I'm going to read it verbatim. It says, I am a white reporter in a mostly white community, but we do have about 30% people of color in our community. I'd like to cover issues of access to care, and I'm looking for story ideas. I used to work in healthcare and know people of color get less meds, symptoms are less believed, etc. What are some great ways to do that? For me, I think you connect with organizations that advocate for people of color and find that person that you can, talk to and get that information from. If it's, institutions like the NAACP who've been around for years and years, that would be a great opportunity. I think you connect with those people, and that way you can get more access to those kinds of stories.
That would be my too. I also see she popped up here, and she said avoid the pitfalls. How does she avoid the pitfalls? I think that's a concern to many of us. But like you said, getting out in the community and really, I think sometimes we forget, we call it in sometimes. Sometimes you have to go out and maybe it's not for a story, maybe you're just going to support something or observe. And that's how you get a lot of, different connections and ideas. So you just got to get out there and find somebody you trust. And
I'd want data on this. One way to never deny stories is to have data. And I always assume there's going to be some kind of data about access and treatment and care. That I want data. And so that's where I would start. If whatever problem you're looking at, I always assume there's going to be data.
Yeah.
So you're
And
not
for
the first
me,
person that came up with it. Somebody has looked at this. What did they find?
and for me, and I talk to other reporters who cover predominantly African American neighborhoods. They go to a good friend of mine, actually. He goes to almost every community meeting there is, and it's not with a camera. He's just there because it all boils down to this. And this is, for me, the way you do it. People trust you. When they trust you, then they call you.
Yes.
If they don't trust you, they're not going to call you. Once you're embedded in a community, and I don't care what you look like, if you're trusted, and I think it's every community, then they will call you with story ideas. They'll believe that you're going to tell the stories, but you got to be trustworthy too. You can't say one thing and then flip the script and do something completely different.
True enough.
And for me, for TV wise, a lot of it comes from me. I'm out emceeing things constantly. And so when people see that you're a part of their community, they believe that you're a part of their community. Even if I don't do the story, they'll call me and say, hey, I have this story. I'll give you a quick example. A friend of mine that I've been friends with for 31 years, we were freshmen in college together, and her niece had a problem with her car. And she called me, of course, because I'm almost like her uncle, but it's not really my coverage area. It's more for the person who does like the Better Call Banking is what we call it, where they go out and solve problems. I had to hand over my story. Now that hurt, but I understand how it works. But
well, where this comes to the coronavirus story is credibility is going to be critical in the days ahead. If I don't believe you, then it won't matter what urgent news you have for me. We're seeing this obviously on the federal level right now is I don't know who to believe. Well, what do you mean you don't know who to believe? Why wouldn't you believe the president of the United States, CDC, epidemiologist, fill in the blank? Well, I don't know whether what they're telling me is the truth. See, you can tell now in times like this, that you're just talking about, Rod, is absolutely vital. If I don't know whether I can trust you or not, at the very moment when I absolutely have to have you trust me, I will have mortgaged that trust.
Yeah.
And boy, I tell you, you just cannot overstate how important that question is going to be in the next 2 weeks.
It's interesting because that's a great question that I just got. What should we be asking the health officials, and what are we missing when we're in these news conferences?
Well, I'll start and Sia will fill in because she's covered a gazillion of these. My questions are always these: what do you know? And there I'm looking for facts. 2, what do you need to know? What don't you know that you wish you knew? How do you know what you claim to know? And is there any other way to look at this? 4 questions. So what do you actually know? What don't you know that you wish you knew? How do you know what you think you know? And is there any other possible way to look at this? Now, there's one other question that reporters like Sia who cover this unfolding story at the ground level are always asking. And this one I found to be the magic question on health stories like this, Rod. What have you changed in your own life as the result of this?
Personal life.
Now that you know this, what have you done differently? What are your children doing differently? And this is how you really know whether they believe what they're saying. I wish they would ask the president this. What are you doing now that you haven't done in the last week? What are you not doing now that you used to do? And so on. But that's where you really know whether somebody believes what they're saying.
There was a bit of that, Sia, when it was asked of the president if he took the test. So there was a little bit of what you're talking about done. Sia, is there anything that you could think of that would help people know how to hone in on the story?
He knocked it out of the park. It personalized. I do get very personal with people. I find the best answers are from when we're not in interview mode anymore. And the photographer, if I'm working with one, says, hey, I just need to get a 2-shot. And so we're just sitting there talking, and those sometimes are the best and answers is when they're not feeling like they're interviewed, you're just standing exchanging chit chat. And those sometimes you get the best answers from that. Yeah, you just sit and wait.
So I'll ask you both this question really quick. What should we not do?
not do when it comes to asking questions? You mean?
What's the number one thing that we should not do when it comes to covering this?
Remember that different questions get different kinds of answers. When you ask a factual question, generally you're asking a question that can be yes or no. Did you take the test? No. Why did you take the test? When did you take the test? What will you do if you get the answer of a positive, and so on? So subjective questions give you much better answers. The other thing that objective questions are factual answers. Generally, they'll give you facts that aren't sound bites. So you're looking for, mostly, what C is looking for is a subjective answer, an answer that only that person could give you, a thought, opinion, feeling, emotion, or observation. She'll write the facts in her copy, right? The second thing that I would say is try to get this person in a setting that is likely to give them the most comfort. So very often, the news conference is not where you're going to get that. Remember that the longer your question, the lower chance there is of them giving you a useful useful answer. We actually mapped this using Pentagon briefings one time, and it turned out that the number of words in the question was in inverse proportion to the number of words in the answer. The longer the question, the crappier the answer. The shorter the question, the better the answer. Questions like, are we safe? Yes. How could you say that knowing the situation we're in? See, we're up to 17 positive cases and 16 of them are it's just shut up.
How do you know the questions that you're getting answered today are going to be relevant tomorrow and true tomorrow or even tonight?
It's not. It's changing so quickly, minute by minute. So no, I mean, the information changes, at least here in Ohio. I mean, it is changing every day. Every day we're getting, I mean, it'll change from day side to night side. So no.
Well, make the problem the story. If when we got this answer at 1 o'clock this afternoon, it's not the same at 6, then that's part of the story, right? What we told you at our midday is no longer true. That's part of your story. So two things here. One, make the problem the story. If the problem is the information is moving so quickly, that's part of your story today. Focus on what I thought I knew and now what I actually know. I think that's really important to keep that in mind. And the other thing is, I always say, think about stories as having a motivator that I might use to lure you into watching, listening, or reading. I always say there's 8 motivators: money, family, health, safety, community are the top 5. The last 3 are moral outrage, curiosity, the coolness factor, or social trending. Those are highly unreliable. So every story you do, if you can make that story affect my money, my family, my health, my safety, my community, that story will live forever, because that story is one that any reasonable person will care about.
Do you guys think that this the coronavirus pandemic is impacting the industry for better or worse? And I'm going to part 2, like subset B that, with another question. How do you respond when the world is hating on the media or blaming the media for the panic, or do you respond at all?
2 answers.
Okay, go ahead.
2 answers. One, it's too early for us to say whether or not we have risen to this challenge or not, because the worst, I believe, is still coming. I think there are 2 ways to think about this. One, are we fulfilling the public's needs and expectations? Are we holding the system accountable in ways that we'll be proud of eventually? My worry, my deep worry, is that the economic decline that we're likely to see in our advertising base is going to come back and hit us hard. Newspapers that were already on the ropes are going to be even further on the ropes, and they've got very little room to go further. So my worry is that this is going to, that we're very likely to have a lot less resources to respond to this than we might have a dozen years ago or more. And that this is likely to take a lot of it's likely to take a lot of jobs, journalism jobs with it.
Yeah, we've already seen
not next
layoffs.
year.
We have a local paper here that laid off people, they said, temporarily because of this as well. So
This is going, I mean, I think that just like every other industry, you know, hotels and airplanes and others, this is going to get us. It's going to get us bad. It's going to get us hard. Now, TV is interesting, right? Because TV viewership is up. You are going to, you two guys are going to be using these numbers to set ad rates, usually when viewership isn't very high.
Yeah.
So
And
will advertisers find a way? Well, drug companies will, and Amazon will, and others will. You're going to see advertising that's going to be home delivery and services like Netflix and other things that can be delivered without touching. All of those things will find a market.
So we're gonna wrap up. We've gone a little bit longer than we had planned to. So we're gonna wrap up in about 5 minutes. So if anybody has any other questions, go ahead and drop those in the chat. But I want Sia to answer the question about how do you respond to people who say it's the media's fault and we're creating the panic. I think all of us have probably seen that video of the reporter. I think she's in Dallas when the store guy came out and was yelling at her. Sia, how do you respond to that, or if you, or would you?
It's hard. I just, sometimes I just have to because you don't want to get in trouble. I oftentimes wonder if my response is worth my job. I'm like, I have to be out here, be responsible. People are watching. People are going to say it. I mean, every day you're out in the field and someone is, yelling out their window, fake news, or something, expletive media. And you have to keep in the forefront of your mind that you have a purpose. You're here to inform the public. You are important. And if you're not here, you're not able to get this information out. And so a lot of it starts with you, in your, yourself in your head. And then you just leave the rest alone. It is hard though.
Rod,
I bite my tongue sometimes.
Yeah. So
Rod, I want to say a couple of things. One, let's make sure we're not giving them the gun and ammo to shoot us. So let's be sure that we're not doing what they're accusing us of doing.
Mm-hmm.
But the second thing is, and I think I can say this because I'm old and I'm not you. Let me say this. What you're doing is important. What you're doing is incredibly valuable. What you're doing is vital. And people are under pressure. People want somebody to strike out at. You're there. You're going to get it because you're the only one I can get to. And so you're going to get it. And it's not fair. It's not right, but you're the one going to get it. But hear me. The work you do is vital.
Yes.
This is going to be legacy work that you're going to look back 10 years from now and you're going to say, you know what? I have a crappy assignment today. I'm wasting my time. I'm wasting the viewer's time, but I did do that. I haven't always had a crappy story. I did something that was really important. And this is going to be important for you to remember in these days ahead because it's going to get tough for you to do your work. This work, Sia and you, Rod, this work you're doing is vital. And do not underestimate it. And don't let people talk you into something that's not true. It's not true that you're the problem. The truth is you're telling them stuff they don't want to hear.
Thank you.
And you know what? And I will tell you two things. We did get a question that talks about, do we have a responsibility? Let me make sure. Okay. In covering coronavirus, do you have a sense of responsibility to share a positive story? And I will answer first. I think we absolutely do have a responsibility to do that. We talked a little bit about that a few moments ago. I think that there's got to be balance. If people are nervous and they're afraid, you got to give them something to hope for. And those stories pop out everywhere. And my Nextdoor app, someone said, hey, we're going to just start going and picking up groceries for seniors if you guys want to volunteer. Their stories are out there for us to do that. So I think we can all do that. So if you guys,
I think of this sort of like I think of sports. The best sportscasts make us feel better about humans. It's like, can you believe they did that? Can you believe, the best sports stories are stories about people who do unbelievable things physically or socially. They do unbelievable things. And
we have a poll that we want people to take. We're going to have that put up really quickly. Please take a few minutes to answer a couple of these questions. Listen, I want to thank all of you guys for tuning in. And I'm going to do that while I'm answering the questions.
What?
I want to thank all of you guys for tuning in. I really, really can't stress enough how much I want you guys to be safe, be vigilant, tell great stories. Those stories are out there. I know that the viewing public certainly wants some great news, and they need to be informed. And I think we really, as Al said, we're really on the front line of keeping the public informed, and what we do is important. So having said that, Sia, give me a couple of just a quick 10, 15 seconds of closing words, and then Al will do the same. And you guys, please take the survey while we're doing this.
Yeah, I want to say thank you for your important work you're doing. You're on the front lines. We're all in this together. You're not alone. You have the support of all of us all over the country. Any one of us you can call. If you need to cry, you need to, bounce ideas. And just to remember, we're all in this together. None of this has been done before. And we just have to be responsible and be mindful. Put yourself in the public shoes. What would you want to hear? What would you want to see? What would you want to know? Keep that in mind. And that's how you go about doing the best work you can do.
What I would say is I would urge all 93 or 100 of you who are on here to be in contact with each other, be in contact with your colleagues. Think about how valuable it would be if Sia or Rod or anybody called somebody, not because you want something, but just because you want to be sure they're okay. Mm-hmm. That would be so valuable. And it's not just texting. I mean, I think there's going to be a time we're going to need to see each other. I'm going to need to see you. I'm going to need to see your face. I'm going to need to hear your voice. It's sort of like when my kids call me. It's different than when I get text, right? I just want to hear them, So call your parents, call your family, let them know you're okay. They want to know. And I would say two other things. One, you're journalists. And what I know about you is that you don't ever unplug. Watch this. Sia, what's the first thing you did this morning? Look at that. What's the first thing you did this morning, Sia?
Picked up my phone.
What was the last thing you did last night?
Picked up my phone.
I know the answer, and so do you. And so the problem is that you're going to bed watching the news, you're going to bed reading your texts, you dream about it all night, you don't sleep worth a flip. And the problem is that when you wake up, you're not rested and ready to go. And you've got to unplug. Do not make the last thing you do consume more news. You've got to stop it. So do what we do with children, right? Read a nice little story about something, and you've got to start taking better care of yourself, because this is going to be a marathon. Some friends of mine from the Seattle Times, and remember Washington State was hard hit, they were talking to me the other day, and it really woke me up, Rod. They said, we're really thinking about how we're going to cover this story for the rest of the year. And I thought, wait, the rest of the year?
Yep.
I was thinking maybe May. No, come on.
Yeah, this isn't a sprint.
We could well have a resurgence in the fall of whatever this is. So they said, this is going to be long term. You're going to cover this for a long time. You got to start unplugging. You got to start taking better care of yourself. And remember, my friends, this is not normal. This will end. It doesn't feel like it. It doesn't seem like it, but it will. And you've got to remember the world around you is still unfolding as it's supposed to. The leaves are still coming out. The trees are still blossoming. There's still birds at my bird feeder. Recognize the little things that are still going right. This isn't, but the world is still going forward.
Yeah.
And we will be on there at the end of the day. We'll still be at the post doing our work, and the work matters. Thank you so much for doing this.
Thank you, Al. Thank you. Thank you. Sia, thank you for being there. And thank you all for tuning in and logging on. And I hope the information was valuable. Again, all of the contact information and a lot of the links that we talked about, including Al's great video with Reverend Sydney, is in the chat. So scroll up to the top and just look for that, and you can clip it and save all of those links. I really appreciate you guys being here. Stay tuned. we may do this again pretty soon. I think we're all going to do that. And my last bit of advice on unplugging, I was off on Monday and Tuesday, and I think I watched about 7 black and white movies. I just took it old school and just didn't pay attention. I think I turned on the news last night to get caught up.
Can I show you? This is what I did the other day. Can I show you? I
Sure.
made my own homemade hand sanitizer that I call Pure Al.
I love it.
Giving this to all my friends.
That's awesome.
Some silly thing.
Yeah, you got to unplug. Thank you guys so much. Stay vigilant and keep up the great work. And we appreciate it. Again, thank you for tuning in to this NABJ webinar. And you guys have a fantastic night. Go unplug, and we'll see you later.